Hey everyone, welcome to another episode of the Coach's Corner University podcast. I am your host, Paul O'Neid, and today I am joined by Andrew Cook. Andrew is the owner and lead physical therapist at Adapt Performance and Training. He and I met through a mutual connection. My friend Jason tore his pec, went to Adam for his rehab, and I was looking for someone to refer a client to local to the Charlotte area, and Adam was the guy, or Andrew was the guy, sorry, and I went actually to visit his clinic and I was honestly blown away. I'd never seen a clinic like that, especially in the physical therapy space. So I knew I had to have him on and to chat about, his story, how he built the clinic, how he expanded the clinic, and, give a bit of a framework for how clinicians can both work in person, hybrid, and provide this higher level of support to their clients. So Andrew, thank you so much for coming on the podcast.
Absolutely, Paul. My pleasure. Glad I could join you.
Yeah, so this has been a long time in the making. I mean, you've been working with my client. We'll leave her name out of it for. I don't think I'm bound by HIPAA, but I know you are.
Right?
Um,
Yeah.
and I've been. We hopped on our first call because actually, you know what? Maybe let's start there. Let's skip the whole intro thing. We'll get into that. One of the things that I think would be incredibly valuable just to start our conversation is the importance of an integrated approach with a coach or a trainer and the therapist working with the client. So, what's your typical strategy for collaborating with a coach? Because I know you and I, we exchanged some notes via email, then we hopped on a call. Uh, and since then, it's just been like communicating through the client. But what's your typical strategy with that?
you know, my strategy is I always want to know all of the providers that my clients are seeing. I don't want to
Mhm.
I don't want to step on toes. I don't want to overlap. I want to make sure that, what I'm doing with them is going to facilitate what they're doing with their other coaches as well. And I think early on in my career, I saw this disconnect with like PTs, especially through my clinical rotations, where they had no idea what the person was doing with their trainer, what they were doing with their, acupuncturist, what they were doing with their physician. It was kind of just like, oh yeah, you do personal training. Yeah, I do a little this, a little that. Okay, yep, and they really had no idea what else they were doing. They kind of just took their word for it. And I was like, it just never made sense to me why we're not speaking with all these other professionals, because if we're all talking and we're all communicating, that's just going to be better outcomes for the client. So, I decided early on in my career, like anytime I know somebody's, seeing, whether it's a coach like you, or they've got a nutritionist, or they've got a chiropractor or something, I want to talk with them. I want to know what they're doing with them. That way I can provide the best care. I can do everything in my power that they need, and then I'll make sure that everything I'm doing facilitates what they're doing with their other coaches as well. Because if I'm doing the exact opposite of what you're doing, you could be telling your client, hey, do this, this, and this. They come see me for PT, and I'm like, oh, hey, I don't want you doing that and that and that. Well, now we've got kind of this sort of give and take. Like, all right, what coach do I listen to at this point? Who's
Mm.
telling the truth? I found like that created a lot of animosity, and then you'd have trainers getting upset with PTs or athletic trainers and physicians. It just there wasn't communication, and I felt like without communication, you just can't provide great care.
Well, you hit something on the head. Like the word facilitation really to me is the key because ultimately I view the role of a physical therapist as trying to facilitate function outside of the clinic. And if the goal with working with a trainer or a coach is to improve performance, your job is let's facilitate your health, like physical health, in a way where you can maximize your facilitation of performance. So it like you are the base of the pyramid. It's like if the person can't move without pain, well then they're not going to benefit from the training and they're not going to get the outcomes that they want. So that to me is like I'm in the same boat as you. I want to know exactly what the recommendations are from a physical therapy perspective and I want to build my framework of training around those recommendations. And one of the reasons I wanted to hop on this podcast with you was I'm so grateful to have a network of physical therapists and physios and chiros that believe in like movement based rehab. And when we hopped on our call, you were like, yeah, she's got some pain, but ultimately it's more so somatic. We need to train. And I was like, oh my God, thank you so much. it was just so validating to me because, this specific client, she's like 2 years removed from an injury. There's no mechanism of injury present anymore. That's healed, but she's still having pain. And you're like, no, we just need to expose her safely to ranges of motion, and then, progress from there. I didn't get these like ticky tacky rehab exercise lists that I'm used to getting. And I was like, I know this is my guy.
Right. Yeah. No banded clamshells and
Oh
very
my God.
light stretching, hamstring stretches, all that good stuff.
So where did your philosophy on, movement-based rehab come about?
So that kind of all started for me in PT school. I was an athlete my whole life. I understood like kind of what it took to get your body prepped for certain activities. I was Division 1 lacrosse player, so I knew how to work hard. I knew how to push it, went it back off. And then I got into PT school. I had my whole mind set on what physical therapy was, what I envisioned it, and it was not that. I got into my first two clinicals and I was like, almost kind of what you were talking about, very ticky tacky, low level exercises. They weren't really pushing anybody. I felt like PTs were more scared to upset their referring doc than they were
Mm.
to actually push their clients and get them better. It was like, hey, we don't want to bite the hand that feeds us. We've got this doctor who's referring us all his shoulder patients and all this. I don't want to push him too hard. So I'm going to kind of just stick with his protocol. I'm going to do very light banded exercises. And when insurance dictates that it's good enough, then we'll discharge him. And that just never sat well with me. I just saw way too many people that were doing the same exercises 3 days a week in, week out for, my 6 weeks of rotation. And I didn't see them getting any better. They may have felt a little bit better, but then at the end, hey, you've hit this mark, so we're going to discharge you. We want to make sure we save a few weeks of sessions for if this pops up again in the future. And I'm like, well, wait a
Mhm.
second. Why don't we just fix it now so they don't need to come back? Why is everything dictated through insurance and what the physician says? And, why don't we use our level of education to determine what these clients need and not have a physician's, straightforward protocol that he gives to anyone from the age of 15 to 85? Like, why are they doing the same things? So I kind of really started going down the rabbit hole there. And then I happened to meet my mentor at a clinic down in Naples, Florida, who it was a really cool blend of personal training and physical therapy. And like the light bulb went off for me. I was like, this is what I imagined physical therapy being. It was all based on weights and machines and movement. We didn't have an ultrasound machine. We didn't have an e-stim machine. We didn't have hot packs, cold packs. There was nothing passive. It was all, obviously manual hands-on therapy as needed. And then we were going to load them. We were going to get them working out. And that's kind of when everything it made sense. And I knew from then on, like, this is PT, this is the route I'm taking. I'm going to base my career kind of on this aspect of physical therapy.
Yeah, and I mean, when I walked into Adapt, I was like, "Oh, this is a gym that just happens to have PT rooms."
Yep.
Like
Yeah.
you've got your performance area, you've got the machines, the dumbbells, you've got some turf. Like there's a ton of space for people to move and perform. And then it just so happens that we've got some treatment rooms as well. And I was like, he's doing it right. And then the next question I had for you, and I asked you in the clinic, I was like, how do you start something like this, especially with the prevailing model? And what you just described sounds more of like a self-preservation model. It's like, I'm going to not bite the hand that feeds me. I'm going to appease insurance. I'm going to only do enough that the person comes back again. You're kind of flying in the face of it, because if your model works, they'll never come back.
Yeah. Exactly. I think that's PTs who they want the safety. It's, hey, I've got 40 hours a week. I'm getting all my leads. As long as I keep doing what I'm doing, I don't overthink it, I'll be fine. I'll retire in however many years, with all my whatever I've got. That's just, again, I just couldn't do that. So, I was like, I started initially, I rented an office inside of a CrossFit gym. And I just gradually kind of met people, got a client here, got a client there. And, it was usually, wow, this is not PT that I've had before. You're actually letting me work out. You're letting me move. And, kind of word of mouth spread a little bit. As my clientele got a little bit bigger, I ended up bumping up, rented a different office inside of a gym itself rather than CrossFit gym, and then ended up taking over the lease, and the rest is history. I kept expanding. We, expanded the first time in 2021 and then expanded again about 5 months ago. So, I always joke like the pro- the biggest space we have in here is our gym. And then, I don't
Hmm.
think you should have more square footage in treatment rooms than you should in gym space. That just doesn't make sense to me. Like if you're going to work people and you're going to get results, you got to have a big open space. You got to have the equipment necessary, especially for all these athletes that want to return back to sport at a higher level than when they were injured. Because far too often these athletes are going back and they're still not even back where they were pre-injury. We're measuring the strength of their, good leg compared to their ACL leg and forgetting that they didn't train their good leg for 6. It's like, hey, what's going on here? Like, let's get them in the gym. I wanted the space. I wanted that open. And like you said, I needed my machines for some of my lower level early on PT. And I knew I needed the dumbbells. I needed the medicine balls. I needed the sleds, the cable systems, everything else to then take them beyond just regular PT and back into, hey, now we're into more of the performance side of things. And we're going to get you back to golf and you're going to feel better than you did before.
Hmm. I mean, that speaks to the runway of progression that you're trying to do. And I mean, we poked fun at the ticky tacky exercises, but I know in some people that's required. Like they need to learn how to make a neurological connection to the muscle that they're trying to train, or we need to put them in safe positions to start, scaling the load on a joint. But there has to be some progression there, and I think that's where the gap exists. And you've kind of built an entire business model around runways of progression, because I'm sure that there's members in your facility that maybe see you on a sparse occasion. Correct me if I'm wrong.
Yeah. Oh, absolutely. I've got people that see me 3 days a week. And then I've got others. I've got a woman, she drives from West Virginia once a month. She comes down, sees me for 2 or 3 visits, and then she drives back home. And she's been doing that for almost 2.5 years now. Um, so it's kind of as needed. My goal for all of my clients is that they don't need me. I don't want them coming back to me because that means I haven't solved their problem. I want to solve their problem so they can
Mm.
go do their own thing. And then, God forbid something else pops up, come back and see me. And hopefully it's not the same thing that we worked on before. And usually it's, hey, you know what? We've taken care of this. You had some back pain. Here's your exercises. If it flares back up, I want you to hit these again before you call me. See if you can't take care of it on your own. And then if not, we'll get you back in.
I think that's a really phenomenal piece. This has been a topic on the front of my mind for a while in different aspects of life, but like creating gaps. So what you're doing in that instance is you're equipping someone with tools, you're letting them go out into the world, you're creating a gap where they have autonomy, and then you're opening space for them to come back if they need it. But ultimately, that gap allows them to self-regulate. It allows them to refine their skills. It allows them to figure out the things that work for them, the things that don't. And then you're kind of acting as a guide in the background, kind of steering the ship on what direction that they could go. And to me, that builds a ton of trust in the relationship. Um, and that's probably what's led to the amount of retention that you have over time of people who kind of see you as needed. And you don't necessarily lose clients in the long term, because if people are training hard and pushing themselves, shit breaks, shit,
Yeah,
falls apart, or
we're
needs a
human.
little bit of an oil change. We're human, exactly. Um, let's talk a little bit of X's and O's here, because I think, with the podcast, we try to cater to how can people start to set up or look at systems around operating any sort of practice, whether it be an online coaching practice, a clinic space, a hybrid practice. You do a little bit of both. You work with some clients remotely, you work with some clients only hands-on in person. You also have trainers at the facility that I'm sure there's collaboration within. Can you just go over kind of the business model that you operate within?
Yeah, absolutely. So, we've combined, like we talked about, the physical therapy and the personal training. So, right now, we've got myself, two other physical therapists, and then I have five personal trainers on staff. All of my personal trainers learn from the PT. So, we have weekly team meetings where we spend, the first half hour checking in, go over any clients, things, issues. The second half hour is always education, whether it's myself or my other PTs presenting on something or the trainers. So we're very big on everybody's learning from one another. And I wanted that model because I wanted my trainers to be able to handle some of these lower level injuries, bumps, bruises, tweaked muscles that popped up, and, not have to have their clients panic like, oh my God, I pulled my back over the weekend. I can't train. I got to go, sit on the couch for 2 weeks now while I'm resting, taking my muscle relaxers. And, we kind of did away with that because we've trained our trainers that way. As far as kind of how it works, sometimes we'll get them in strictly as personal training. Sometimes they come in strictly as PT. And the goal is that, they transition down through the ladder. They start with physical therapy, whether it's with me or with other physical therapists. And then our step down from there would be our ADAPT program, which is a doctor assessed personal training. So now we've kind of moved you from that traditional sort of physical therapy, and now we're into personal training, but still with a doctor of physical therapy. So now it might be 5-10 minutes of some mobility work, something in the beginning, and then it's right out into the gym. So now they've got kind of that confidence. We're teaching them how to lift, how to move, and they still feel better because we're there. We've got the PT right there. Once they finish the ADAPT program, it's, hey, some of them continue with us. I've had clients with me now for 5+ years on my ADAPT program because they want to train with a PT, mostly because they've got other issues, musculoskeletal or some other type of autoimmune disorders that, not that a regular trainer couldn't handle it. They just want that little extra level of care where if something pops up, they know I'm going to be able to take care of it. The other PT is going to be able to take care of it, vice versa. And then from the ADAPT program, it's right down into our personal training. So we'll have people work their way all the way down through. They get great at it. They really get bought in. They're loving how their body's feeling. And then it's, hey, you're welcome to stay with us for personal training. Or when you're ready to go out on your own, here's the program. Keep us posted on what's going on. If you need anything, we're here for you.
I love that. And you've got other adjunct therapies and things in the clinic as well. Like I know you have an IV facility as well. Like what other things do you have under the roof?
So right now we've got our IV nutraceuticals, and then we have a mindset coach as well who will work with whether it's athletes who are stuck in a rut, or a lot of times it ends up being sort of our older business clients who might be at a transition point in their life, trying to create new habits. They've got new goals, whether they just sold their business and now, hey, what am I going to do for this next chapter? And she'll work with them as far as goal setting, creating routines, new habits, things like that. And what's actually really cool is she has an 8-week mindset course that all of our trainers are required to go through in PT. So every single one of my physical therapists, personal trainers, are also certified mindset coaches as well. Because let's be honest, sometimes, and I'm sure you get it as a coach, there's days when people come in, we're more psychologists than we are trainer. They're having a shitty day, something's been going on, and we end up talking to them for, 20, 30 minutes. And, maybe we get to 20 minutes of a workout and they feel great when they leave. We may not have pushed as hard, but we listen to them. We understand how to work through some of the troubles they're having, and we can still incorporate the strength training with that. And I feel like that's really helped us create that trust with our clients, that they keep coming back because they know they're going to come in and they're going to have support regardless of what's going on in their life.
Yeah, one of my favorite, I guess, axioms when it comes to training, nutrition, fitness in general is the physiology only matters as much as the psychology allows.
Yeah.
So if you're blocked up between the ears, especially like now in the age where pain science is becoming more and more prevalent, we understand the role of the central nervous system in that pain response. For so many people, pain is simply just fear, right? It's a chronic fear of accessing ranges of motion, which feeds into avoiding those ranges of motion for a really long time, and then losing motor control within those ranges of motion over a really long time.
Yeah.
So if you're going downstream, might as well start with what's between the ears first.
Absolutely. And I'll bring up kind of our mutual client we had. One of their biggest issues was the fear of that movement. It was, I think the first session or two we spent, a lot of it was me reassuring them, hey, you can do this movement. Your spine is not broken. You are strong. You're doing the movement. It's just you fear this movement so much that your brain's creating this pain. And it's really cool. We see it in the research, especially with our chronic low back pain that we almost get this reversal of, normally you walk up, you pinch somebody, it sends it to the brain decides, all right, does this hurt or not, sends the pain signal back down. Whereas this chronic back pain, you see, instead of an initial, you know, pain or something that happened, it's you start to bend down to touch your toes. Your brain says, I think this is going to hurt my back. So it automatically sends that tightness, that pain, even though we know they're fine. We know there's nothing wrong in there, but we see this reversal in the central nervous system, and it's kind of breaking that cycle and getting them back into the, hey, I'm okay. The body's resilient. I can do this movement. Now let's just load it gradually, be safe, be cautious, and create the confidence in that movement.
One of the things I need to highlight here, kind of give you some flowers, as the kids say, is that with this client, I was running into a lot of roadblocks, and I'm personally not afraid to refer out, right? Because as a professional, I understand that there are things that are within my scope and things that are outside my scope. And with this specific client, we were making some progress, but then she got pregnant. So that's a whole other dynamic of pelvic
Mm-hmm.
instability and all these other things that are coming along with it. And so there was an increase in that fear and avoidance of ranges of motion. So I said, "Hey, I need you to see a physical therapist." And in my head, my primary goal with having her see a physical therapist was to give her some confidence. And so that validation that she got, that she was not broken and that she was physically capable of moving, that really, like, that unlocked it for me, as a coach to work with my client. And then on top of that, I see that as another gap that I can create, right? I create space for my client to go see another provider. Note to coaches listening: make sure you vet your providers, because if you make the wrong choice, it's going to bite you in the butt.
Oh yeah.
But that reassurance that she got, that she was not broken, coming from a doctor of physical therapy, she was able to progress her training like crazy, to the point where, yeah, she's got a few like tweaks here and there and like twinges, but we know that that's just because she hasn't been in those ranges of motion before. And then now the pregnancy compounding that, she's lost in hip internal rotation because she's got a
Oh
belly and
yeah.
all this sort of
She
stuff.
got a lot more going on now.
um,
Yeah.
she's got a lot more going on now. So yeah, you absolutely crushed it for me. And I think maybe you could speak to this. I think there's a lot of fear with referring out. I think there's a lot of fear that, oh man, like it's a scarcity mindset. Like if I refer out, it's going to make me look bad. It's going to make me look ill-equipped, and maybe I'll lose that client to this provider.
Yeah. I think that's the big issue is everybody views everybody else as competition. If we're doing our job right,
Mm-hmm.
as we should, and we refer out, like I said, as long as I trust the process, I know I'm a good PT, I know I've done the right work, I'm going to refer them out for something that I know is out of my scope. I know they're going to come back to me. One, probably because if they get help from that referral, that looks even better for me because, hey, I've accepted, I know my limits.
Mm-hmm.
Let me refer you out here. And then now, okay, you got the help you need. Come back to me, and now let's keep progressing. Whereas, like you said, there's this scarcity mindset where it's like, oh God, if I admit that I can't handle this situation, nobody's going to trust me. I'm going to lose this client. They're not going to come back. And in reality, like I said, it's the opposite. Having a good referral
It's
source.
the
And,
opposite.
that's the big thing with my personal trainers here. And I tell them that, like, that's what's
Mm-hmm.
nice about having us on site is, hey, fellas, like, you don't got to worry. I'm not taking your clients from you. When somebody's beat up, you bring them right into
Right.
PT. You let me know. We'll talk to them. We're going to get them right back. Problem is you've got other trainers that, like you said, they're worried. Hey, man, if this PT really helps them, what if they come back to me? What if, you know, I lose this client? Now I'm out this. And so they tend to like, it's almost like they want to hoard all their clients, try to do everything they can to get them better. And then if they can't, they end up losing the client anyway because now they haven't helped them. Whereas, you refer out, you get some help, and now
Yeah.
they're back as your client.
Yeah, I think that last piece is the key. It's like, oh, well, what if they leave? Well, what if they stay with you and don't get any better? Doesn't that look way worse for you?
Yeah, exactly. That's always how I view it. So I don't know.
Well, and my entire ethos around like the business that we operate is like, I'm trying to raise the bar for coaching. And the only way to raise the bar for coaching is to see other coaches as an opportunity for us to like bolster the quality of care that we can give people. So again, like if someone has an expertise that is beyond mine in a specific area, and that's the gap that my client has, from an ethical standpoint, I feel like I have to refer out.
Yeah,
Like it's a necessity.
absolutely. Like,
Um, so go ahead. Go ahead, sorry.
oh no, I was just agreeing. Like, I feel like if I can't do, or help this client, then I'm absolutely going to refer out because it's selfish on my part to keep them coming in and just try and, throw the kitchen sink at them until maybe something works. And then if not, hey, I just lost them as a client for good because now I couldn't help them at all, rather than just send them out, get them back,
Yeah,
keep it going.
for sure. One of the things that I wanted to chat with you about, you had mentioned that you do some hybrid online, in person, and then you also do some remote physical therapy. One of the one of the things that I see from the clinicians that I work with on the business side of things is they have a lot of trouble, especially with the assessment, trying to either hybridize or transition that fully remote. What are potentially some strategies that you use or that you've seen to be effective, especially when it comes to that assessment piece?
Yeah, it's always tough with assessment. I'm big on if I can get my eyes on them in person, like that's, my first choice. Obviously, can't do that all the time. So I think the biggest thing
Hmm.
is you've got to be able to have an assessment that you can run them through, whether it's virtual or, however you're doing the session when they're not in the clinic, that you can get the information you need. I've got a screen that I run people through, whether they're in the clinic or not, that gives me a lot of the information I'm going to need. Basically just a full body takes 5, 6 minutes tops just to work them through it. And after that, I've got, 80% of what I need to know already. Obviously the other 20% comes from sometimes doing a little work on the table, kind of teasing out a little bit more of the range of motion. And I've got things that I can do if it's virtual that I can have them kind of show me that. So just being able to have progressions, regressions, and some different variety of specific exercises. So you can see what you need to see, the patient can feel what they need to feel, and then you can make the adjustments.
Are you doing like a really detailed like client history? I feel like that would be a really big
Oh,
part of a remote
absolutely.
assessment.
Yeah. I mean, remote or in person, I spend a good, at least, obviously we're going to have them fill out their assessment paperwork. I'm going to take a look at that, but then I'm going to dig into it a little bit as well. I'm probably the only PT that I want to know what their workout regimen is. I want to know what their body part split is if they're doing it. We're going to take a deep dive into as much as I can learn about them as a person, physiologically, biologically, whatever it may be. I'm going to get all that information. So that way, now I've got that. Then you go into the movement screen, and at that point, I've got almost everything I need to see because they've answered all their questions. And
Yeah.
usually, from a good detailed history, I've already got, by the time I'm done with that first 10, 15 minutes of the background, I've already got like half my treatment plan prepped in my head just based on what they've told me, what they're doing, what they're feeling, and then you put that movement screen in next, and that kind of fills in the gaps as needed. So
Have you kind of adapted your own movement screen, or are you doing like an FMS or something along those
it's
lines?
it's a little of my own. It's part FMS, part SFMA, part a few movements that I like, and it's kind of all combined. It's changed over the course of my God, what am I, 11 years now? So it started out a little different, has evolved to where it is now. That
Mhm.
way, they run through it. It basically covers every joint in the body. I get to see stability, mobility, their range of motion, their balance, certain movements that may cause pain, may not cause pain, and that's going to give me all the information. And I'm always big on that. I tell other coaches, other PTs, like, hey, there's a lot of great assessments out there. Start with one that's already built for you,
Mhm.
and then kind of tweak it and make it your own. Because let's be honest, nobody's reinventing the wheel at this point. I'm sure you can agree as a coach, like we know the science, we know what works, we know what doesn't work. Every now and then something new might come out and we can say, okay, you know what, let me add that to the training. But for the most part, progressive overload, working the range of motion, mobility, stability, everything else, that takes care of it all. So why try to get super crazy, fancy? I feel like the the more absurd it is just for social media
Yeah.
stuff. Like they just, oh yeah, look at this. This is crazy. I'm gonna work through this and this. And I'm like, well, yeah, that looks cool. What's the purpose though?
Yeah, one of the things that I always try to hammer home to people is like, if you're going to do an assessment on somebody, make sure it's something that you're actually going to use. Like, I see it all the time with coaches who have these massive intake forms, and I look at it and I'm like, do you really need to know all of this stuff? And the argument could be made, yes, the more equipped I am with answers, the better I'll be able to serve the person. And I totally agree. But I'm also of the mind that like we need to be efficient and respect this person's time.
But yeah,
So if there are things within the assessment that you just don't need to look at, like if they come in for their hip, maybe you don't need to address their, I don't know, you can make an argument for anything, but like maybe you don't need to address their shoulder, right? Um, One of the things that you said, like not getting fancy, is something I found with myself. Do you find that over time your assessments have gotten, number one, more and more malleable? Like you don't do the same assessment on two separate people. You have things that you switch in and out, and then count in the same breath. How much of your assessment is actually just training?
yeah. Um, it's funny. I was just having this conversation with somebody, and we were talking about, whether you need a full evaluation and, if you need the full hour to go over something. And I was like, no. I was like, if you do your assessment correct and you can alter it for the client that's in there, I'm like, 15 minutes in, you already know what's going on and you're into the workout next. So, I agree. Like I've got my basic movements of my assessment that everybody's going to do regardless, and it's malleable. So I know
Yeah.
if it's more lower body, I don't have to worry about some of the upper body stuff. I may still have them run through it quicker, but I'm not going to be as focused on it. Um, yeah, as soon as they're out of that, it's like, all right, hey, we've got it. I've got enough. I don't need the full hour. And it's by design because my goal, especially on that first eval, is I'm going to get all the information I need. We're going to go through the movement screen. And at that point, now I've got, 25, 30 minutes still. We can actually start to get a workout in, start to do some PT or some, whether they need a little bit of dry needling for pain resolve or cupping, something along those lines that they get more out of that initial session. Because I've seen PT clinics where the first initial eval is all just talking and paperwork. And by the time you're done, they really don't even have a plan yet. You haven't done anything for them. So they're leaving after that first day, like, all right,
Yeah.
what was the point of coming here? So I always try to teach, a lot of my PT students, current PTs that we have here, hey, make sure you've got 20 minutes at least at the end where you can do something with them, because you can think you have all the
You
information,
want them
but
to
until
win.
you actually load it up a little bit and do something, you may not have that whole picture yet.
Yeah, I totally agree. Like my assessment strategies have definitely evolved over the years, but a big part of my assessment is that first week of training.
Yeah.
How are we moving? Like send me some videos. How are we moving? How are we loading? How are we hinging? How are we flexing? How are we extending? And then from there, you just get a much more clear picture because, as you mentioned, something might happen as soon as you introduce load to a body. Some things happen, especially like my population, like big, strong dudes. If I try to get them to do a dowel overhead squat, they're failing that test every time.
Yeah.
But if I put a loaded barbell on their back, they could squat beautifully.
Mm-hmm.
So and the opposite is also true. They might be able to perform this beautiful overhead squat because they're hypermobile, but put them under load and they look like Gumby. Like we're gonna have some problems. Um, you mentioned earlier some of the limitations of insurance, the insurance-based model. Consider me a bit of a noob because transitioning from the Canadian system to the American system, I've had to learn a little bit about the operations. But you are completely outside of the insurance model. Was that a hard transition for you? Like, why did you make that choice?
I actually was never part of the insurance model. My mentor I mentioned earlier that
Never.
had that, never. I I met my mentor. He had
Wow.
that hybrid PT personal training clinic, and he was out of network. Like I said, I had seen enough with insurance where, so I'll give you kind of this visual. And there's great PTs that are in insurance clinics, absolutely phenomenal PTs that I feel like are handcuffed
Yeah.
because of the insurance model. Because you've got some clinics where
Mm,
you've got a half hour. Hey, somebody's coming in for a half hour, and then immediately you're going to somebody else, and then you're going to somebody else. Or it's, hey, you're going to come in, you're going to see the PT for 15 minutes, and then you're going to go see a PTA. And the PTA is going to be the one who's going to run the programming for you for the next 6 weeks until you get to see the PT again, and he's going to reevaluate you. But, I saw a lot of, hey, you're going to go do 3 sets on that banded external rotation. Go ahead, hey, 10, 10, maybe rest for 20, 30 seconds and 10 more. And I'm watching it, and the client's butchering the movement. They're not counting right. They're not resting. And meanwhile, the PT's just trying to catch up with his notes. He's typing up everything. He's trying to fill out all the requirements for insurance, because if you don't fill it out correctly and you don't put the right info down and you don't put down what insurance companies want you to put down, they're going to deny it. So now you just worked with this
mm,
client, you've done all this, and the insurance company says, no, you didn't fill out your paperwork right. We're not going to reimburse you for that. So now you've got the front office or whoever's in charge of billing. They've got to call the insurance company. Hey, what's going on? What do we got to take care of? And the other issue is that with insurance, you're really restricted to basically a joint above and below. So if they're coming in with an elbow issue, I could probably work down on the wrist, fingers. I can work up into the shoulder, maybe the thoracic spine. But that client tells me they've got a bum hip or something's going on in the knee. Can't touch that. That I won't get reimbursed for that, because my doctor's note says left shoulder or left elbow pain. So I've got to stick with that. Whereas, as an example, I had a client
mm.
who tore his shoulder. He came in, early on in a shoulder rehab. I don't need an hour with them. And what we did was we'd work on the
Right.
shoulder, and then we're fixing everything else with him as well. We're working on his bad knee, his low back, because he's been sleeping in a recliner for the first, 4 weeks after the surgery. So it really,
Oh,
I feel
that
like
was the
it
worst.
handcuffs. Oh yeah, sleeping in the
Dude, you
recliner
mentioned
after
the
a
sleeping
shoulder.
in the recliner. I remember I remember that one of the hardest parts about my knee surgery was sleeping in the like hospital bed in my office because my sternum hurt. I
Okay,
ended up getting like a costochondritis in my sternum from being so rounded
just
over
yeah,
in that like
stuck in that.
slouched posture.
Yep.
Oh, it was brutal. And yeah, I luckily enough, I wasn't going through insurance, so I could address that with my physical therapist. Um, but actually, you know what? On that subject, that brings me to another thing. So, working with insurance, they also have like functional benchmarks or like specific benchmarks that you have to meet until you can graduate somebody.
Mm-hmm.
Now that you're outside the network, what sort of framework do you use for progression? I'll give some context for my question. So, when I was working with my physio, um, he had never worked with somebody as strong as me or as big as me. He had worked with NHL players, which was an asset for me. But like for example, he would put we had that like knee sled thing that looks like a supine leg press
Mm-hmm.
for isometrics, and he's like, "Okay, we're going to start with 40 pounds." And I got in the thing, and it was already off the off the pins. He's like, "Don't push into the plate." I'm like, "I'm not pushing into the plate. That's just my resting tension."
Yeah.
And then it ended up getting to a point where I couldn't do an isometric with less than 120 pounds of tension on the machine because I couldn't feel my quad doing anything.
Mm-hmm.
And he was like kind of baffled by it. But what we had decided on was instead of going by arbitrary, like week benchmarks, like at 8 weeks, you're going to do this, at 12 weeks, you're going to do this, we went off functional benchmarks. So
Yep.
when you can perform this exercise, we're going to graduate to this exercise and so forth. What sort, like now that you're outside the network, you have full freedom, you have full flexibility. What's your philosophy on, progressions?
So I would agree the same way. I'm more functional based. Obviously we have to take into account tissue healing time. Somebody tears a shoulder,
Mm,
gets surgery. I know, all right, I can't put a ton of load to that shoulder for at least, X amount of weeks. And what I can do is I can work up to kind of that tolerance of where I know the tissue can handle it. I use a lot of blood flow restriction training, which allows me to push my clients a
oh
little
yeah.
bit further muscularly without putting as much stress on that as well. But for me, I always joke I run more accelerated programs because I base it off of function and not just, oh, you've got to be at this, this, and this. We're usually well ahead of schedule in a lot of my rehab clients because I am pushing them a little bit more than what they typically would. But I'm gonna base it. Hey, we did 20 pounds, looked good, movement was smooth. I didn't see a lot of shaking. How'd it feel? Yeah, felt good. All right, perfect. Let's up it. We're not gonna go crazy heavier, but we're gonna continue to up it until I either see the full
Yeah.
breakdown or I know, hey, this is my max weight we're going to because I know we're only X amount of weeks out from surgery.
So you're using kind of a dual approach of, tissue healing. Like you can't really get away from tissue healing time.
Yeah,
Like for me, it was, hey, bro, we got to wait for your fractures to heal.
yeah.
So you're going to be in a wheelchair for 6 weeks. And I was like, all right, I really can't like speed up the rate at which my bones heal outside of, nutrition and PEMF and stuff like that. But that was probably the hardest part of the rehab for me was the 6 weeks in a wheelchair. I was like, fuck me.
Oh, yeah, I
Um,
probably felt cooped up.
one of the things you've alluded to a couple times in this call is the different modalities that you have access to, and like it speaks to how robust your toolbox is. Now, what sort of tools can you use in insurance so that maybe you or sorry that you can't use in insurance based therapy that you now have access to that can maybe accelerate uh, rehab protocols?
The one that comes to mind is probably dry needling because insurance doesn't typically reimburse for dry needling. And I'm also not going to go out and say
Okay.
that dry needling is the solve all. You've got some PTs that I'll dry needle for an hour. No, I utilize dry needling as one tool in the toolbox just to promote some blood flow,
Mm.
get a little bit more mobility, and then obviously we're going to go load them like that. But, as far as what they have access to, it's about the same. I think it comes down to, again, the time I get to spend with them. I know I'm going to get an hour with them every single
Okay.
time they come in, so I get more time to work on. I combine a little of the dry needling first to a little decrease in pain. Let's improve the blood flow. Let's get them a little bit more mobile, and then I roll into the blood flow restriction training because that does take a little bit longer with the setup. You've got your specific protocols, certain time that you've got to rest, but I have that time. The hour, I know we've got the hour, so I'm going to roll into that, and then I've still got time to go load them in the gym. So as far as tools, it's about the same with insurance. I know a lot of PTs who take insurance that do dry needling, and they'll just charge separately for it. It's usually a cash price of $40 for dry needling. Well, that's included in mine. Like,
Mm.
yes, you're paying out of pocket, but you're getting everything all in one. You're getting the programming, you can get dry needling, all the soft tissue, and you've got access to us for any questions with your home program as well.
I love that. Can you speak a little bit to kind of how you've progressed your model over time? Because, it sounds like when you're working in the CrossFit space, it was just you. Then you went into the gym and it was just you. And then I'm sure it didn't jump from, hey, I'm working out of a gym to I own a facility with 5 trainers and 2 assistant PTs. Like
Yeah.
how did you kind of scale how you added to the team?
So I can't remember who I heard it from. Really good business coach, everything with basically my whole philosophy was I'm not going to get a bigger space until I've outgrown the space I've got. So I kind of outgrew that
Okay.
CrossFit gym. So I moved into my other space, got a little bit bigger office, had a little bit more autonomy with the equipment that I could use and everything. Got to the point where I was full with that. And I was like, okay, I feel comfortable now based on my clientele, what I'm bringing in a month. I felt like I could take over the space I was in. So basically, it was a 2,000 square foot facility. So I was like, all right, I'm ready for this. Signed the lease, took that over. And as soon as I did that, I brought on one trainer. So I was like, all right, I've got,
Okay.
my clientele. I know what I can cover for this, rent, all the other utilities, everything. So brought in my first personal trainer. That way, for me, it was like, hey, now I have a personal trainer and I've got myself as a PT. From there, it went into hiring my second PT. So they came on board. At that point, we were close to outgrowing our space, and I
Mm.
had an opportunity to take the space over that was next door to us, and it was really kind of an ultimatum from the landlord. He was like, "Hey, I know you are looking for space in the future. I want to give you the option to take over the space, and I can't promise that I'm not going to give them a 3-year lease if you don't take it. So that was really the only big risk I took, was I expanded a bit sooner than I would have wanted. I would have liked another 6 to 8 months, and it was one of those. I was like, I gotta roll the dice a little bit here. I gotta put myself out there. I gotta take over the space. Um, so we ended up expanding over, and from there, that's when it kind of got real. I was like, all right, now that I've got this bigger space, I've got to bring on more trainers. So over the course from like 2022 up until now, it was building the right team. I had some people here, had to, they left, went to do other things. No harm, no love lost. It was just they weren't right for this fit. Not everybody can become part of like an out of network physical therapy clinic. You get these PT students that work in typical outpatients, and then, hey, I'm going to be my own boss. I want to come be a cash based PT. Let me come work for you. All right. And then what they don't realize is it's a little bit more than just collecting a paycheck and having that constant referral source. Hey, you've got to do a little marketing. You've got to prove your worth, because now people are coming in spending good money with us. If they're not seeing the results in the first couple sessions, they're going to go somewhere else. Insurance,
Yep.
I've got them. You're coming in 3 days a week for the next 8 weeks. I could be as shitty of a PT, and you're still going to come back because you're not paying anything for it. Oh, well, I'll just keep coming until, I start to feel better. We don't have that option. So it kind of went from there. We brought on our first salaried employee 2 years ago, and now we're at 4 salaried employees, a few hourly trainers. Like I said, we've got our member relations specialist up front now. So it gradually, we kind of added as we needed. I had a lot of hats early on, and as it got to the point where I could hand off some of those hats, I handed them off. And that's always the scary part, is you feel comfortable, you're making good money, but you're like, you know what, if I want to continue to grow, I got to spend a little bit, I got to bring somebody else on so that I can keep building the business. So it took me a while, and now we've kind of got that team where it's running smooth. We got great trainers, we've got great PTs, we've got our mindset coach, our member relations specialist. So it's having the confidence and, having the guts to kind of step outside the comfort zone a little bit and be like, all right, if this doesn't work, then what's next?
Dude, that's actually a topic that I don't think I've dived into on the podcast before, is hiring and building a team. What was the process for you in that? Because I mean, I mentioned before we hopped on that we're working with a brand strategist, and one of the things that I really wanted to dial into is like, hey, what are the core values of our business, and what are we looking for in the coaches that we hire? Because we've onboarded a couple coaches that just weren't good fits, and it really worked against us in the goal of building a very aligned brand. So I'm wondering, like, how do you go about hiring the right people for your team?
It's taken me about 5 years to figure out, and I'm still learning. So I
Okay.
think early on, I was hiring out of necessity. I expanded a little sooner than I wanted, and I needed to get some people in there. So, I was vetting them, taking them through the interview, and I wasn't quite as picky. So I brought on some of the wrong people early on, and it's a hard lesson learned. And, it got to the point where finally a really good friend of mine and mentor, he looked at me and he's like, you've got to stop being scared to spend money. He goes, you're trying to hire people out of necessity. You're trying to make them like 1099 contractors. He goes, bite the bullet and just hire a salaried employee. He goes, vet for the right one, because when you get the right one, it's going to be worth it. And that right there kind of changed my whole outlook. I was like, all right, bit the bullet. I hired my first salaried employee, and I'm like, all right, now I've got this guy who I'm paying 40 hours a week. I've got to get him clients now. And you know what? We got him filled.
Right.
It's great. And next hire. And you know what? You're going to get somebody who says all the right things, that, answers the questions like you want, and you hire them, and then you're like, oh, yeah, you know what? This wasn't the right person, because there's the interview and there's what they expect the job's going to be, what you expect do for the job, and then they get into it, it's like, yeah, no, this isn't working, and just not being afraid to say, hey, I made the wrong hire. I'm going to learn from it. I'm going to replace that person. No, again, no love loss. It didn't work out. This, what you were thinking it was, what I needed, it's not aligned. So we're going to have to go separate ways. And you learn from that interview. All right, what questions didn't I ask that person that I need to ask the next person? What, you know, I took, early on, I hired a couple PTs without doing a practical with them. I didn't have them take me through
That was going to be
like
my next
practical
question.
exam because again, I needed somebody. I was like, hey, I gotta get somebody in here. They said everything I wanted them to hear in the interview. All right, you're hired. Well, now, no, they don't get hired until they take me through a practical. So first interview is always with myself. I'm going to get, whether it's personal trainer, PT, I'm going to learn more about their background in regards to their training style, their education, their specialties, clients they're comfortable with, who they can see, who they can't see. All right, great. They passed that interview. Now they interview with my wife. She's got her master's in clinical mental health counseling. She's our mindset coach. She's going to interview them from the standpoint of how do they fit our business? How do they fit our other employees? How is it we make them take a personality test? That's going to give us, hey, here's their personality as an individual. Here's their personality when they're in business. So it's really cool. You kind of get to see both aspects, and you'll show it to them like, hey, as an individual, this is your personality type. And when you're in business, here's what it is. She wants to know what they do outside and what their hobbies are, their activities. All right, they pass that interview. Yeah, they seem to have a mindset, head on their shoulders. Third interview, clinical with me. I'll give them an outline, a scenario. Hey, I'm a 40-year-old so-and-so with, left shoulder, right knee. And then after the eval, you're going to sit down and you're going to tell them which plan is going to be for me. They pass that, now they're hired. Or at least now we're going to offer them a job.
So once they're hired, is there any sort of like probationary period?
3 months. So we have a 90-day probationary period. So initial contract that we send them is for 90 days. At the bottom, there's a spot on all of them where after 90 days, we have our evaluation. I sign it, they sign it, and it rolls right into their year-long contract. So, that gives us that first 3 months to see, all right, does this work for them and does it work for us? Because you know what? They may come to me at the 3-month mark like, hey, you know what? This isn't what I thought. A bit more work I was looking to get into. I'd rather kind of go back to just doing what I was doing. Or I may look and be like, hey, we've had, you've worked with so-and-so, these clients, they weren't either happy, they didn't renew, they didn't come back for any reason. What happened? This and this. All right, hey, I don't think you're right for us. We're going to have to go separate ways. Or, hey, man, you crushed your 90 days. Everything looks good. Here's your contract. Sign it, and you're up for the next year.
One of the things that I want to pull out for the audience is how methodical the process is for you now. Like to have 3 interviews, including a practical and a probationary period. You're really embodying that principle of like hire slow, fire fast.
Yeah.
Because one of the things that I'm a stickler for, and I feel like you'll align with this well, is like any risk to the brand and my reputation, I have zero tolerance for risk there.
Oh, 100%. I mean, that's the hardest thing is, you always want to clone yourself, right? I wish I could have 5 of me because I know exactly what I'm going to do. It's hard to hand off trusted clients to people and then they mess it up. Like, it's almost like referring out to a bad coach. That's going to come back on me. They're not going to be upset at the PT that they got. They're going to be upset that I put them with that PT. And, we had a situation where we did have to let somebody go more so because, we kind of went through. It was the same thing. Nobody was renewing with them. Their retention rate was just very, very low. And I kept at, what's going on? Why aren't people coming back? Like, what are you saying? What are you doing? Then I got my first complaint and then I got my second one. And then I was like, okay, I kind of see what's going on now. Hey, this isn't working. We're going to let's go our separate ways here. And, they went back to more of a traditional outpatient PT job where, again, I don't want to say, because I don't want to piss off any PTs, I don't want to say it's easier. And like when you clock out at a normal PT job, there's nothing on your mind. I clock out. I'm thinking, all
Yeah.
right, I've got this client, this client. Here's how I'm going to prep. I had, it's a funny and terrible story. A physical therapist that I was shadowing with, it was my second to last clinical rotation. We were in the hospital. It was all like total hips, total knees, spinal fusions. It was on the ortho floor. And at
Oof.
one point, I kid you not, he looked at me. He's like, man, he goes, I enjoy doing this job because I don't have to think. It's the same thing every day. When I clock out at 4, I don't have anything on my mind and I don't have to think about it until I get back in here the next day. He goes, and then I'll retire in 30 years. And I just was like, what? Like,
That ain't me, dude.
that is not me. And like, that's not a PT either. Like you just told me like you don't have to think. And he was Paul, he did the same exact thing with every single knee patient, every single back patient, and every single hip patient. By day 2, I was running an entire schedule. And I was like, this is just not physical therapy right now.
It's disheartening, but I think it's a limitation of the model. And I think the more people like you who step outside of it and show what can be done, um, the better off everyone will be. And I think if you're someone who's listening to this and is maybe a client or looking for a physical therapist, I think looking for a physical therapist who actually is client driven, right?
Yeah.
That client centered approach where they're going to have a big toolbox. They're not afraid to be a little bit risky and are going to push you rather than, hey, you're going to see me 3 times a week for the next 3 weeks, 2 times a week for 3 weeks after that, once a week for 3 weeks after that, and then we'll see you later.
Yeah.
If they like, I feel like for you, it's like, we're going to see you until you don't need to see me anymore. And ideally, that's going to be as soon as possible.
Tell people, but my goal is that they don't need me. So, hey, I only need to see you once a week as long as you're doing what I tell you to do outside. Now, do I have people that come
100%.
more? Yeah, because they'll tell me, hey, I'm not going to do it unless I'm here. Okay, you want to come in and see me 5 days a week for PT, which I've had
I
people
have a
do it.
client like that.
They've got the money.
Yeah.
It's no issue to them. Like, hey, I'm going to come in. I'm going to show up every single day here because I know if I don't come see you, I am not going to do it at home. Which, okay, great. And then I've got my others where I give them their workout. They are going to do it methodically for the next week until they come back and see me next, or even 2 to 3 weeks in between. Because I know how methodical they are, I can extend them out a little bit. So they end up not having to see me as much, which
Yeah.
there's time and there's money. You know, do you want to go to PT 3 times a week for 8 weeks? Or would you rather come see me once a week for 5 weeks, take 4 weeks, and then maybe come back in, for another week? Like, what's
Yeah, but
worth
you have
more
to
to you,
be
your
willing to
time or your
take
money?
advantage of that autonomy. Yeah.
Oh, yeah.
I have a client. He approached me about coaching, and I was like, yeah, this is how we operate. This is the price. And he said, if I pay you 3 times as much, will you call me every day for 15 minutes? And I said, 3 times as much. I mean, yeah, as long as it's at a time that works for me. He's like, yeah, it doesn't matter. Let's pick a time every day. We're gonna have a call for 15 minutes, and that's gonna be my accountability. But I'll pay you 3 times as much. And I was like, there are just people who have no desire to do anything on their own. But here's the thing: I've been working with him for 3 weeks. He has missed 0 calls with me, and he's been perfectly adherent. So what works
Oh,
for some people doesn't work for others. And
no.
I mean, I'm okay to make 3 times as much money for a call that I take on my way home from the gym.
Right? Yeah, you're not going to say no to that. It's funny. It was Tuesday actually. I had a client ask me the same exact thing. He was like, hey, if I come in and pay you double, will I show up more? And I was like, well, that depends. Like, is the money that important
Yeah,
to you?
how
And he
much
had to
is
think
double
about it.
worth to you?
And, he's a very wealthy client. So he thought about it for a second. He's like, oh,
Yep.
yeah. He's like, I might have to pay. I was like, look, I'm not going to ask you to pay double. I was like, how about this? How about I will call you on the mornings of your appointment just to say, hey, get your ass to the gym. And he goes, deal. Perfect. And I was like, all right. But, again, like you said, your client, the money made a difference. For this guy, I knew it wasn't going to make a difference. I was like, he
Yeah.
could pay me 10 times. and it still wouldn't put a dent in his pocket, and it's not going to get him to show up. I was like, I got to find another way to get him in here.
Do you find, like, this is something I talk to coaches a lot about? Do you find that the quality of the client improves as your price scales?
Um, I would say to an extent. I feel like you get some people that just start charging crazy prices, and they just
Hmm.
happen to be in an area where money's not an issue. We've got decent price. It's 170 for a physical therapy session with us. It's a good amount, and it's, believe it or not significantly higher than the low range of things. I know people charging 200, 250, 300 an hour, but it's because again they're in the middle of Los Angeles, and people out there will just pay whatever they want to pay. Um, I've found more so it's not the price of it; it's going out of network versus in network. When they're out of network and they're coming in and they're
Ah,
paying at the time of service for their PT, and what we actually do is we require them to pay before they book. So you want to come in and do physical therapy with me? Hey, you called, you set your eval, you set your date up. They pay then. So now they've already paid for that session.
mm,
That tends to get people coming in a little bit more than if they
that's
have to
very
pay
smart.
after their session. And that was a lesson I had to learn early on, was we were getting some cancellations. And I was like, what can we do about this here? And I was like, all right, here's what we're doing. We're going to charge people when they book. Like, to lock that spot on our schedule, you're going to pay for it. Now we have a 24-hour cancellation policy. If something happens, we get it. As long as you call us 24 hours before, you get refunded, or we just push the session out. If you no show us and we don't hear from you, I'm sorry. Our time is valuable, just like your time is valuable. Our client's time
Yeah,
is valuable. So I found that it's that
yeah, for
paying
sure.
up front, like, now I'm committed to it. I've paid my money. It's just, again, with insurance, there's no money exchanging hands. So hey, if I'm not getting better or if I don't feel like going that day, I'm just not going to go. Well, most of my clients, they're going to show up because they've already paid their 170. They want to come and get their money worth. So,
Mm, yeah, that makes sense. Um, I want to be mindful of time here. So I have two questions that I ask all the guests on the podcast. The first one is, if you had a billboard on the side of the highway for everyone to read when they drove by, what would it say?
oh man, billboard on the
Good, eh?
side of the highway. I would think it would have something with adapt at the top. But, my big thing is, oh, what would I have it set? Man, Paul, you're putting me on the spot with that one. Now I'm trying to think. So,
I know.
I would
I
almost say
know.
take control of your life. Like, that's my big thing for my
Yeah.
clients is I want them to take control, or let's say take control of your health and wellness. That's my big
Mm,
preach to everybody. It's like, they come to us. They're sick of just going through the motions and everything, and now they truly want to change. So if you truly want to change and take control of your health and wellness, come see us at Adapt. That would probably be my billboard.
I love it. The last question is, if there was one person that you would like to see me interview on the podcast, who would it be? But the caveat is that you have to help me get them on.
Oh boy, one person. Man, it's almost funny. I don't know why, but I'd like to see Jason on a podcast. He's
I
just
would
very
actually love
smart.
to see Jason on a
He's a
podcast.
very smart individual. I'd love to see what you guys could talk about him. Uh, or honestly, I really think my brother-in-law. So you know my brother-in-law. I think
Okay.
you know Brandon.
I've never met him. No, no.
Okay, yeah, all right. So yeah, he's a PA. His specialty hormones, testosterone. You know, kind of has that niche in the bodybuilding community. But man, if you want to talk about somebody very smart, very educated, who's also kind of changing what a PA does and how they run things, he would be my suggestion.
That's actually a great idea. And sorry, I said I don't know him. I definitely met him once.
I was gonna say, I thought you said you had met
That'd
him
be awesome.
briefly at a show somewhere,
Yeah, yeah,
but
yeah, I did. I
he's
met him.
just
I met him at Jason's
okay.
place.
Yeah, he's just one where
Yeah.
me and him are very aligned. He's very research based, and he's in that of do no harm. He's not going to load up his clients with all sorts of supplements and drugs and everything. He's going to give them the least amount that they need to get to where they are.
Hmm. Yeah, that'd be a great one. Dude, thank you so much for your time today. This was really, really valuable. I appreciate it.
Oh, absolutely. It was a pleasure being on here. Had a great time chatting with you.
Yeah. So, yeah, if anyone wants to find you, where can they find you?
So, they can find me. Our Instagram is Adapt Performance Center. www.adaptperformanceandtraining.com if you want to take a website. And, I always welcome anybody just stopping by the gym. We're located right off Stutz Road in Mooresville, North Carolina. So look us up, stop by. I always love giving tours because, like you walk in, it is not what you expect from a physical therapy clinic. It is
Not
much
what you
different.
expect.
We've reimagined it for sure.
Absolutely. Well, thank you so much, everyone. Thank you for listening. Please make sure to like, share, subscribe, ring the bell for notifications. We'll catch you on the next one.